Hello and welcome to Our Toxic Nation, a call for Reformation Summit. I'm your host, Rachel Roshek, and I'm excited to announce today's guest and topic today with Dr. Paul Anderson. Welcome.
Thank you for having me.
Thank you for being here. Our topic today is patient access to integrative therapies, a decade of challenges. But first, I would like to introduce you to our audience. Dr. Anderson is a recognized educator and clinician in integrative and naturopathic medicine with a focus on complex chronic illness and cancer. In addition to 3 decades of clinical experience, he also was head of the interventional arm of the United States National Institutes of Health funded human research trial using IV and integrative therapies in cancer patients. He founded a clinic focusing on cancer and chronic diseases and now focuses his time in collaboration with clinics and hospitals in the United States and other countries. Former positions include multiple medical school posts, professor of pharmacology and clinical medicine at Bastyr University, and chief of IV services for Bastyr Oncology Research Center. He is co-author of the Hay House book, Outside the Box Cancer Therapies, and the Lionecrest Publishing book, Cancer, The Journey from Diagnosis to Empowerment. He is also co-author of the IV textbook, A Scientific Reference for Intravenous Nutrient Therapy. Thank you again for joining me today.
Thanks so much.
Okay, so today we're discussing patient accessibility to integrative therapies. And what do you believe are the biggest barriers to accessing integrative healthcare today?
Yeah, I think that's the best place to start because so many people on one end of the spectrum benefit from integrative healthcare access and the different modalities that can be used, et cetera. But so many more people either don't get much access or don't even know that that's possible, which are all access issues. So I think, there we could probably list 50 reasons, but the big categories that I see that slow or totally block access to people are first, finances.
Yes.
So largely integrative medical care. Some might be covered with your insurance. Most of it is not. Much of integrative healthcare is considered experimental, which excludes it from insurance coverage by, either rule or statute. And so finance certainly is quite an issue. And we, let alone people who are getting treatments that are covered by their health insurance, the way health insurance is now in the US, still people have a lot of out-of-pocket expense. So imagine if the out-of-pocket was even higher, we have people paying very large amounts of money just to access integrative healthcare. So I think finance is a really big barrier to entry. And of course, most of that is facing towards the patient. There's other financial issues along in the system, but I think finance is number one. I think number two, and this could get to be a very complex discussion, but the bottom line of it is uh, medical education as a barrier to entry, if you will. It's different now than it was, 30 years ago. But what we see is, while there might be a awareness of integrative therapies and approaches and things in medicine in general, the big medical system, unless it's something where maybe your hospital has a specialty clinic that's integrative medicine or something like that, there's nothing done about it because the the doctors and my colleagues on, what I would call the, establishment side of medicine, largely think that anything that they didn't learn about in their training must not be real, must not be scientific, etc. And so this prevailing thought process along all of medicine that if we're doing it in the big system, it's scientific and it's real. and it should be paid for. If it's done anywhere else, it's not scientific, it's not real, etc. Uh, and and there's a pretty big not only divide philosophically there, but also the underlying thought process is fairly prejudiced. For example, there are you mentioned I've written a textbook and some other books, and I do a lot of other writing. In one book alone, just about integrative therapies for patients dealing with cancer, there's 1,100 references from peer-reviewed medical studies. So, there certainly is more science than people believe there is for a lot of what's done. So I think that the medical education, that's the big first layer, is getting past the idea that it doesn't work and it's not scientific. The second layer, which I'm involved in a lot, teaching continuing medical education, is while we certainly have more and more healthcare providers interested in learning about integrative therapies and things like that, um, if you go to your average primary care general practitioner, et cetera, they're so busy, they're probably not, involved in learning about those things. So it's not that they maybe would have to do these things for you, but they wouldn't even know where to refer you. So it's sort of the medical system and the education and, the prejudices work against you. So that's number two. And then number three is something that unfortunately I've had a lot of experience with doing advocacy with the government, and that's regulatory blocks to entry.
Yes.
Um, and so what that basically means is beyond money and beyond medical education of all layers, if there are therapies that might be helpful to you, but the regulatory system that allows therapies to get to patients becomes more and more restrictive, the therapy may exist, but you may not be able to get it. So let's say, finance wasn't a problem and medical education wasn't a problem. If you can't get the therapy, you're kind of stuck, or if the therapy is likely to get your provider into legal trouble, that becomes a barrier to entry for you. And like I say, there could be many, many other things, but I think finance, education awareness, and then regulatory restriction are probably the biggest things.
That all, yes, that all hit home for me. I feel like I've experienced all three of those issues, and the regulatory part of that is a big factor, I think. So how do you think healthcare accessibility has changed over the past decade, and what improvements, in your opinion, still need to be made?
Yeah, I've thought about this quite a lot, having uh, been involved in medicine for a very long time and seen changes. One of the things that is, it, it's just the way it is. It's sort of a two-edged sword. If you go back 20 plus years ago, there were so few providers doing integrative healthcare that you could maybe find. And I'll use myself as an example. We were in the big medical system, and we had largely decent coverage through medical insurance for what we did. But it was because it was such a minority, nobody even noticed, that we were doing something different, maybe. Um, a big change since then has been, and I've seen this firsthand, uh, the finance part, insurance companies realizing, oh, we're going to pay for things in this box here, and anything outside that box would be considered just deemed experimental. Now, that usually is a determination not even made by a government agency. That's just made by the insurance company. They get to decide what's in the box and what's outside because they're paying.
Right.
Uh, and so one of the things I've seen financially has been the narrowing of what we do pay for with insurance in the box
Mhm.
and the expansion of anything else that's not going to be reimbursed, not going to be paid for.
Right.
So that's been a huge change. Uh, and it's been codified in the language of almost every insurance company. I'm sure there's examples that aren't, but any big name one you can think of, that's part of it there. So that's been a huge change, and it's only gotten progressively more um, uh, aggressive, you could say.
Mm.
Um, I think if we're looking for silver linings, a positive is because I've been involved in educating physicians and healthcare providers for over 30 years. A positive is that the number of people that, say, 20 years ago used to come to a course about an integrative therapy, that maybe, if you're getting integrative therapies might be real common to you, but no one else knows about. The number of providers was very small, and they tended to be, only in sub-fractions of the medical community. So, sort of marginalized providers, really. Uh, in the last, probably from 15 plus years ago till now, we've seen a big escalation in, physicians and other healthcare providers from all over medicine coming to courses to just say, is there something to this? Would this help my patients? How could I do it? Uh, so I think if you want to look at a silver lining, the number of healthcare providers aware of these things is growing, but it's still a fractional percent of, all of the healthcare providers. So I think that's been a good positive turn. But because I work with those providers and I work with the medical groups that do teaching, the frustration then is once you get a provider very excited because they're going to learn these new things to help their chronically ill patient. And then they realize, oh, it's not going to be reimbursed by insurance and it might get me in trouble with my medical board or, some other thing. And it becomes very frustrating for them. So that's kind of a two-edged sword. Um, and then, I think that the changes, especially of the last 10 years, but you could maybe scoot it out to 15 in regulatory overreach, is how I would say it, have just escalated, extremely quickly. Um, you had mentioned in my bio that I did some research that was funded by the National Institute of Health for integrative cancer therapies, and that was really a wonderful time to be doing research, et cetera. It was sort of right before all of this regulatory escalation happened. And if we were trying to do that research now, we either would not have access to the things that we were using back then, or it would be extremely difficult to get access to the therapies that we were doing back then. And I don't know whether it's, that was some sort of plan somewhere, or it's just the way that the regulatory system works. But what we saw and what we've seen, especially in the last 10 years, is both on the federal level and the state level, uh, organizations like the FDA and state boards of pharmacy going and saying to providers, you can no longer have access to these things. Um, and even in some cases, it's ongoing right now, a very famous uh, case of FDA actually putting onto an approval list a couple of integrative therapies that are very commonly used in the autism spectrum and chronic illness and autoimmunity things. And then a very large state in the United States deciding through their board of pharmacy they're not going to allow those to be accessed by doctors in their state. And unfortunately, I mean, it would be bad in any state, but this is a state with one of the biggest population states in the country. So you have all these sorts of things going on, and unless you were a patient who was using one of these things, you would never even know, that
Mm.
access was restricted. Um, and depending on what direction you want to go with that discussion, there's examples, but there's also examples of, potentially why why would the government start to care about integrative therapies that are really a minority of, if you consider the percentage of people who would get standard drug therapies, et cetera, it's kind of a minority. Why would that happen? But the bottom line is it is happening, and it's not getting better.
Yes. Yes, and from a patient perspective, it's heartbreaking and incredibly frustrating. When you get to the point where you learn that there are therapies out there that can not just change, but save your life, and you don't have access to it because of regulations, or if it's a financial thing with the insurance. Like, I know personally, I don't even, when I'm looking at new treatment modalities, I just assume I'm going to have to pay out of pocket. And
Yeah,
I have to figure it out, and it's not a good place to be, that's for sure. So, um,
yeah.
what role well, we kind of touched on this a little bit. What role do socioeconomic factors play in a person's ability to access healthcare, and what can be done to address these disparities?
Yeah, I mean, I think regardless of what kind of healthcare in the United States, the way that the insurance system is, as we talked about, but also just the way that um, the medical care model is set up, the less money you have, the more likely it is that you're going to be extremely limited as far as the provider you can see or providers. And the system that those providers are in may be very restrictive as far as, unless you've had a major emergency, it might take you quite a while to get, seen, and then also maybe take you quite a while to get the, diagnostic workup and other things
Yep.
that you need. The other thing that a lot of patients don't see, because of course they're not feeling well and they just want to be helped, is the lower your socioeconomic status and the lower the amount of money you have available, et cetera, if you're in one of those systems that gets narrower and narrower, the provider then, which they often don't, relate this to the patient, but the provider may only have access to a minority of diagnostic things that they can even order and do for you.
Yep.
And then that translates to what could be treated, for
Mhm.
you. So, and so the counterpoint to that is you say, well, that's lower socioeconomic status. Why can't they do that? It's because anybody maybe just above low socioeconomic status to middle, income levels, et cetera, might have enough discretionary money to go to another provider outside their system and say, I'm still sick. I've been worked up for these things. They've done these tests, and they say that you're basically healthy. We don't know why you feel bad. So they go to a provider outside their system, pay out of pocket to do that, and then they find out that provider does, maybe 5 times the amount of testing and investigation and things. And I've gotten this question a lot, is why didn't my primary care do that? Well, it's because the system you're in that's paying for it will not allow them to, even if they wanted to, or you'd wind up paying for it anyway because they're not going to pay for it. So the less, and it's a linear equation and it's logical. The less money as a patient you have access to, the more you are completely required to use your whatever your healthcare is in the system. And that's going to be fine for emergencies. It's going to be fine for basic primary care, but they're not going to pay for anything else. And they're not even going to pay for the healthcare provider to look anywhere else for your problems. So if you're chronically ill, it becomes a very inefficient system. And
Mhm.
like I say, if you have enough money to go outside the system, you can pay for health care, which is sad, but that's what happens. If you don't, and you're barely getting by, you have no extra money for health care, uh, you're just not going to get any options presented to you.
That is painfully true.
Yeah.
There is a dollar sign on life in this country, and it's feels criminal as a patient. And our healthcare and the way that we're able to treat has evolved, and I really feel that the system needs to evolve with it. We've had a lot of advancements that have been proven over and over and over that just need to be rolled in to the conventional care model, in my opinion.
Mhm.
Do you think that our current healthcare system, and this is, I'm asking you this question, I already kind of know the answer. Do you think the current healthcare system does enough to ensure rural or undeserved communities have access to care? And how can that be improved? I know telemedicine can probably fit in here.
Mhm. Yeah, I think from a different point of view, it's similar to low socioeconomic status restrictions. Uh, I will say that the big system of medicine uh, is and has done probably as much as they can to get to underserved areas, rural areas, et cetera. Now, it's still under the same restrictions that we just talked about, but I have colleagues who work in underserved rural clinics, and they're largely funded by government money to keep the clinic going because there wouldn't be enough funding otherwise for the rural area, for example. And I was just with some of those colleagues doing some healthcare advocacy in the government, and we were talking about, how's that going, and what are your limitations? And the bottom line is it's the same limitations of, boy, we have people come in, and once they find out that we do, standard healthcare, but we also offer some integrative therapies, we've got lots of people trying to access it, but the amount of money we have to provide that, and the kind of the timing, and also just the number of providers in a rural area, you're limited by a number of factors. So it's unless you happen to have a provider in your rural area who does integrative medicine, the access to healthcare in general is harder, because you
Mhm.
have less options. And then the access to integrative diagnosis and treatment is even, more narrow because you're just limited to the provider types that you're able to see.
It's unfortunate. So if you live in a rural area and should, heaven forbid something happen, you
Right.
are very limited as far as what you can and can't do. And that's heartbreaking. What do you think is the most important change we need to make in healthcare to ensure it is accessible to future generations? I know
Hmm.
that's a big question.
Yeah. 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 That's a huge question. I think actually if we look at those three big, stumbling blocks to access for people of financial things and healthcare provider education, and then access to therapies, actually regulatory access, I think those would be the places that I would start to try and address, really. Um, if you don't address the financial aspect of it, it's always going to be something that's for the most part available to people of more means, middle to higher income levels, or not, So there has to be, as part of that, something looking at the financial system that we built up to give healthcare in this country.
Yes.
There's lots of places that could be done differently and probably better. So that's one thing. Um, I think provider education, as I mentioned earlier, some of it is simply, you know, y- y- one way to think of it is most healthcare providers are not sitting thinking all integrative therapies are bad, and
Right.
they can't work and all that. Most of them are just so busy doing their job that unless the system that trained them originally says, hey, you should think about referring for these therapies that other people do, they're going to think, well, there's probably nothing to it, or it's what we hear a lot is there's no science, so what we do is scientific, what you do is not scientific. So those sorts of just awareness and prejudices would need to be really worked on. And it's not that every healthcare provider, in the system would have to start doing these things. It would be they would see when they got a chronically ill patient who is not progressing and not getting better, that they could refer to another provider who does these things, and just be aware of it.
Yeah.
So I think that's a big piece. And then if, quite honestly, as far as regulatory things go, if we could undo the last 10 to 15 years of regulatory overreach from both state and federal levels, um, it could be done very safely for patients. The safety aspects of regulation are one thing, and then the therapeutic overregulation is a totally different thing. So if we could keep the safety regulation portion of what, which the government is responsible for making sure things, are as safe as they can be. If we can keep that part and undo the restrictive nature of taking therapies away that the government simply didn't like, for whatever reason,
Right.
um, that would also increase access. And, as you've experienced personally, and as I've watched with my own eyes treating people all these years, um, what I have available to use with patients with chronic illness now is significantly restricted from what it was 10, 12 years ago. And so that's not like 100-year time span. That's a very short
No,
time span.
that's really interesting. I didn't know that the past decade has been worse. I mean, it would make sense because we've had more integrative therapies kind of become available. I guess there's more to regulate, maybe. I'm not sure, but it's interesting.
Yeah, I think the mechanics of it it's complex. There's a number of reasons for that, but the bottom line is that that is the way it is, and at least as of this moment in early 2025, there are no changes, in the winds for state regulatory overreach or federal regulatory overreach. So, um, I would I would hope that starts to change, but that is not the reality right now.
I'm hopeful with you. Hopefully things will move in the right direction. All right. Well, that's all the questions I have today. I really appreciate you taking this time with me.
I really had fun. Thank you. It's a
Thank
tough
you.
topic, but
It
I think
is.
what you're doing, getting the topic out to people is wonderful.
Well, thank you. Thank you. It's definitely been a part of my life. It's been a lived experience for me. So I could talk to you for hours on this topic, but I think we touched on a lot of really important factors. So,
Thank
all
you.
right,
All right.
take care.
I'll see you. Bye.